I'm Sonia Azad. Welcome to The Shift, a place to inspire growth, resilience, and wisdom, real connection, healthy conversation as we navigate life's changes and challenges together. Because, as I like to say, we are all each other's teachers.
Thanks to our friends at The Wealth Woman for making this podcast possible. Hair and makeup generously provided by Glam House Collective.
Hi, I'm Sonia Azad, and welcome to The Shift. We are at Sanctum Med and Wellness today, and I'm joined by Dr. Lyndsey Harper, who is a women's sexual health expert. Good to see you.
Thank you. I'm so glad to be here.
So I like to start each episode by asking, how are you feeling today in one word, a one-word check-in?
Excited.
Excited. I'm excited too, because we have a heck of a topic that we're tackling, and that is sex.
And here's the thing, is we don't have to whisper about it today, right?
This is true. We can speak loudly about sex.
You can do it. It's going to be okay.
This is going to be the hardest interview I ever do in my life. How did you get into this field? Because it is a narrow focus.
Well, it sounds like a narrow focus, but it actually affects everybody, right?
Yeah.
So it's a very wide focus. And what I was experiencing in private practice as an OBGYN is that my patients were coming in literally on a daily basis, patient after patient, with a sexual health complaint. The number one sexual health complaint is low sexual desire, but a lot of patients were having sexual pain, trouble with orgasm, arousal, and I had not been taught how to handle any of these things in residency. I spent 2 weeks in an erectile dysfunction clinic as a medical student, but learned absolutely nothing, even as an OBGYN, about women's sexual health. And 43% of women have a sexual health problem. So nearly half of women are struggling with these issues, and we as their physicians, unfortunately, aren't trained to help them. So I became really mad, and then I became really passionate, and now that's my life's work.
Wow. Okay, when you say 43% of women, is that like a specific age group or age range, or is it just like
it's all comers? So it's
Wow.
That study was done in ages 18 to 65, and we see women in all age ranges as well. And that's the thing about sexual health that I love and find so fascinating, and I think is helpful for us to recontextualize, is that we've never sort of tackled sexual health, right? We encounter different phases of life where we're, faced with new sexual health challenges or problems. This may happen during puberty. This may happen, when we're first becoming sexually active with sexual pain or just questions, because many of us don't receive adequate sex education. This could happen around the time where we're thinking about children, whether it's infertility, during pregnancy, postpartum, menopause, cancer diagnoses, partners with sexual health problems, chronic disease and illness. Stress is actually a really big cause of sexual problems. So, whenever we think about sexual health, I like to think of it as a journey, and we're constantly navigating, learn how to be better communicators, and access resources to help, our overall sexual health and well-being.
Well, okay, so I have so many questions. When you say problem,
yes,
I'm like, how do I know if it's a problem?
Well, it's a problem if it's a problem for you, right? So this is actually a really common question, is women will come in and say, how do I know if I have low desire? Like, how many times should people be having sex?
Yes,
right? This
great
is
question.
Really common. And this is the hard answer, is that there is no right amount. The right amount is the right amount for you. The right amount for your connection with your body, for your overall health and pleasure, and for your relationship or relationships, right? So if any of those parts of your life are not working for you, then that's when you might want to seek intervention or, help from somebody who works on these problems.
But what if it's working for you, but it's not working for the other person?
Yeah, that's really, really common. And that's called a desire mismatch.
Oh.
And it's just like everything in life. Like, we might come into a relationship with two different philosophies on parenting or with money, right? And so it's all about, can we negotiate these differences successfully? That's the same for sex. And so when you come to an impasse where, for whatever reason, you're not able to negotiate those differences with your partner successfully, then that's when, help can come in. You can learn how to think about sex in a different way, rather than just the way that we've all been brought up to think about it. We can think about it encompassing lots of different types of intimacy and pleasure. We can also, work with a therapist or a counselor to try to come to a place where both, people in the partnership are getting what they need for their own selves and from the relationship.
So when someone comes to you and says, Dr. Harper, I'm experiencing pain,
Yeah.
right? Is the first question like, what are you doing when you experience pain?
Yeah, well, pain is actually really common. So 75% of women experience pain at some point in their lives or another. Yes. And this can be because of inadequate lubrication. This can be because of childbirth or pregnancy. This can be because of hormonal changes due to menopause or lactation. So there are lots of things, also endometriosis, there are lots of things. There's something called vaginismus where the pelvic floor, the muscles are contracted during the time of intercourse, or even with tampons or like a speculum insertion. So there are lots of different causes for pelvic floor pain and sexual pain. So, and there's a lot of things that we need to answer. So yes, the answers could be, how long has this been going on? Are there any certain positions where this happens or where this doesn't happen? Are there any things that you can do prior to, intimacy or during intimacy to avoid the pain? And these all kind of help people who are passionate about this to connect the dots and try to figure out what is the cause of your pain, so then we can get to the treatment for your pain faster.
Yeah, and I think you mentioned communication already, and I think that part is so important, whether you're communicating this to a physician or even to your partner, because then otherwise I feel like women silently suffer through a lot of stuff.
Absolutely.
And don't talk about it. And then I also feel like the partner might misinterpret that as like, this person doesn't desire me or whatever else.
Yeah, you have really gotten to the root of the problem, which is that we might be experiencing a medical issue, right? But then because of the silence that we have learned to, surround sex with, it gets blown up into these other things that it never was to begin with, right? So for example, if a woman's having sexual pain, and then it's very natural that if she's having pain, she's going to avoid sex, right? She's not going to have desire for sex. And the way I talk to patients about this is to say, hey, do you want to stick your hand in like a fire? No, you definitely don't want to do that. Just like you don't want to have sex. That doesn't mean you don't want intimacy, you don't desire pleasure, but it hurts. And so that's the core of the problem, right? So what happens because of that is that their partner oftentimes will misinterpret, their partner's not getting what they need out of the relationship. And the next thing you know, it leads to all of these unnecessary consequences. When if that woman knew that pain was super common and that there are interventions for her pain, that we could avoid all of these, unnecessary effects downstream.
So does this,
You're doing great. You're doing great.
I need her here. Okay. Does this happen, I want to go back to the age question, because does this happen more with awareness, like once you're in practice of these activities? I feel like my parents are going to be watching.
But they need it. I'm telling you, this is open conversation with everyone in my entire family, from my grandparents
I'm sure they
down
love you.
to my children. You know what I mean? It's like this, the problem is everyone wants to talk about sex, but no one knows where to talk about it or to whom to talk about it. So the fact that you're starting this conversation is going to be awesome for everybody in your life.
It's going to be awesome, you guys.
This. Yeah.
Okay, so do you see more people coming in because they've had sex for longer periods of time, right? Like coming in their 40s or their 50s, or is it younger? Is it older?
Honestly, it's across the board. And I would say in younger patients, sometimes they're especially in maybe more conservative communities like the South or like conservative religious communities.
Yes.
There is this idea that, sex is bad, sex is dirty, a lot of sex negative messaging, especially for women while they're growing up. Don't let them take advantage of you, on and down the line. I think a lot of us have heard all of this. And then these women are in a situation where sex all of a sudden is permissible, like marriage, and all of a sudden they're supposed to flip to this sexual goddess. And that is a huge brain switch to do. And so a lot of women are struggling with sexual pain during that time, with experiencing pleasure. And so we see a lot of patients in that time frame. We see patients of all ages who have had experience with sexual trauma or violence. Definitely during pregnancy and postpartum is a huge time, but also infertility. And this isn't really talked about enough. But when patients are experiencing infertility and they have to start to think of sex as, a function of trying to become pregnant, or they're not able to become pregnant and they want to, then sex gets put in this like stress category. So it can really change the couple's relationship with sex. But also, like we talked about, on into menopause, and particularly for breast cancer patients, because their sexual health is really never addressed, but they've had their breasts removed, they've had their ovaries removed, they're often on hormone blocker drugs, which has a negative consequence on sexual health. I mean, I literally could go on, but many of the medicines we take affect our sexual health.
Yeah.
So it's women really throughout the lifespan.
Well, that's why I feel like we all need someone like you, because there aren't that many people who are willing to openly share.
Yeah.
I mean, I keep going back to the pain thing, because I feel like that should come up in your annual, if you're going to a gynecologist once a year, which we're supposed to do.
Right.
You know, I mean, she feels around, he or she feels around, right? And we're having conversations. Right. But why doesn't that come up?
It doesn't come up, sadly, because we're not trained like we should be. And, you know, as I mentioned...
As physicians, you're saying. Okay.
Right. And so because we are people too, and we're embarrassed to have these conversations too, we don't know the questions to ask of our patients that will leave them not feeling embarrassed themselves. We don't want our patients to think something about us or that we're trying to pry. So it's the same, you know, unfortunate context due to this lack of education, conversation, and really modeling about how to have these conversations. I work a lot with physicians and train them on how to talk to their patients about sex. And what I found is that everyone's just a little unsure about how to approach it. Like, patients kind of want to talk about it. Physicians know that they probably should be talking about it, but no one's just really sure how to do it. And so when we are able to model for them just simple questions and, you know, how to handle certain situations, and then really just the next step for those patients, then it opens up a whole new opportunity for this physician and their patients to really get them to the resources that they need and deserve.
So I've heard from my friends who are like 46-ish, 47-ish, that like when you talk about desire, their desire like shoots up, and so they sometimes have a mismatch with their partners, or, you know, some of these women I'm thinking of are divorced, so they're coming into new relationships. Right. What is happening hormonally at that 46, 47 time where we're like...
Yeah, so really the experience of perimenopause and menopause is different for everybody, right? So some women may experience a shift and increase in desire, others may have a tank. And so I think it's helpful to communicate that whatever's going on for you, nothing necessarily is wrong. It's because hormones really are like kind of all over the place during menopause, and so that has consequences on sexual function and desire. I will speak to the divorced women because they are in a new and novel situation, and we know that novelty obviously, and many times for many women, increased desire. And so that's the situation that many women and people who are in long-term relationships have to try to recreate, is how do we get some of that novelty back in our lives if we don't want to switch partners, right? But how do we kind of try to create that sense of newness? So there's a lot of things going on for the women that you're talking about, changes in their hormones, changes in their partnership status. And it really helps us to develop this idea of how our entire sexuality is informed. It is a function of our medical, situation and our hormones. It is a function of our mental health, stress and anxiety, and it is a function of our relationships, whether, those relationships are in a good place or not, or new, or, have been around for a lot longer. And so when we think about sexuality in this really holistic way, it kind of opens up the avenues for different opportunities for improvement.
How do you feel about pornography?
Ooh, such a good question.
I'm just going there.
Okay, so here's the deal. So, what I do know is that many women who have what we think of as spontaneous desire, so this is like the traditional, I'm just, thinking about, maybe sex sounds great tonight. Like I should take some actions to make that happen. But as we age, spontaneous desire might start to go away. And then we have something that's called responsive desire, which means that many women need exposure to a sexual cue in order to kind of get that pathway in their brain going. A little bit like when we haven't been working out for a while and we kind of forget why we ever were working out in the first place, because it takes a lot of time and I got to take another shower. And it's just a lot of work. But then I go to the gym and I'm like, this is why I like working out. It feels good, right?
You're talking about the mind-body connection.
I'm talking about the mind-body connection, which is so huge in sex, for real.
Yeah.
And so the same is true for sex. So when you're kind of out of practice practice for a while and you start to kind of expose yourself to these sexual cues and you're open to them, then it can kind of help you to kick back off this responsive desire pathway. So I'm a proponent of erotica for women, which is written literature, written stories about sex.
Like the 50 Shades of Grey, when that became so popular. Okay.
Exactly, because we have a lot of data to show that it actually improves women's sexual health significantly in terms of desire, in terms of lubrication, and in terms of orgasm. And this doesn't mean that you are not attracted to your partner or you don't want to be intimate with your partner, but oftentimes I teach my patients to think about erotica as a prescription, right? Many of us are searching, like, give me the pill to increase my desire, and I'm like, well, actually, here's one that's relatively inexpensive and has no side effects, and we know has great data and works, right?
Wow.
And the good thing about erotica for women is we're not taking on like the physical forms of the people that we're seeing on the show, because for many of us, for many women, that can have sort of a negative thought process in our head, like, oh, our body doesn't look like that. And lots of porn is made through, quote unquote, like by men, sort of for men, right? And not focused on female pleasure, which is different in real life than is depicted in most porn. And so, you know, these are all things to think about. I don't think porn is intrinsically bad by any means. I think sometimes when people are having problems with porn, it's usually indicative of something else. But I don't think it's helpful for us to be like, porn is bad and, you know, something else is good. I think it's, you know, in the middle, just like everything else in life. And it just depends on how you use it, what the intention is of it, and how it's either benefiting or taking away from your experience of your life.
And maybe communicating around that, because I feel like I've talked to a lot of women who are like, my husband watches so much porn, it's because there's something wrong with me, or like I'm not desirable. And same with like sex toys.
Sure.
Like I always have to take a breath before I say these things.
You're doing great.
Because it's like, you know, then, you know, women internalize this stuff a lot of times, right?
It happens all the time. And that's there we get back to the problem with no conversation, right? And I've seen this happen so many times. I will get on a stage and talk to 300 women about sexual health problems, and there will be a line of women crying because no one's ever talked about this. They have never talked to their partners about this, and they feel like they're about to get divorced. You know what I mean? It's been building and building and building and building for sometimes like 10 or more years, just no conversation. And the same is true for, I think, problematic issues with porn, right? So there's something going on. Someone's needs are not being met for whatever reason. It's unlikely that it's the partner's issue at all. It's probably more likely, you know, the person consuming all of this problematic porn. But the fact of the matter is there's not been enough sort of digging into it, or enough education, or maybe even enough, you know, clarity into one's own situation so that they can communicate their needs more clearly.
What do you want men to know about women's sexual health?
You know, I think that just to your point, the same way that women sometimes take on, you know, problems with porn or whatever, like men and women actually have a lot of the same sexual health problems. I think men feel the same way. They might think, oh, she, you know, has no desire, so that means something bad about me or bad about us. I think that it's important to take a step back and view your partner as a whole person and understand that there are many different things that sort of make up who we are as sexual partners and as individual sexual people, and to have compassion for whatever that is. And that can allow us to move into a space together where we can work through problems with curiosity and with open communication and conversation. And if all this feels too big, then there are really some great resources, some great books. You know, there's the Rosie platform, there's counselors, there's all kinds of places where we can start to educate ourselves so we can have more open and honest communication with our partner and our healthcare providers.
Yeah, talk to me about Rosie, because I feel like once people see this, they're going to be like, I need this woman in my life. So Rosie Wellness is your baby.
It's my fourth child, affectionately called. So, you know, whenever I started learning about all this, I'm like, man, there's so much here, and it's really not that hard. That's the whole title of my lecture to physicians, Women's Sexual Health. It's not that complicated. And I just want people to have access to the information. Like, the outside of the woman's genitals are called a vulva. They're not called a vagina. Like, this is mind-blowing. And
basic, 101.
Basic. But people, we just don't know that as a society. And that most women experience experience orgasm through clitoral stimulation, not through penetrative sex. Mind blowing. I mean, like, these are simple facts that are just not shared. And so when we have access to resources that are just educational in nature, or when they're specific to a sexual health problem, like learning about responsive desire and erotica as a prescription, or for breast cancer patients, understanding really what the treatment options for sexual pain or lack of desire after breast cancer treatment, right? When we can connect the dots for women who are in need with the resources that are available, I just think that that is such an important work for women themselves, for our overall health, and for sort of our families and the world as a bigger place. So that's what Rosie's all about. We're here sort of as a holistic, platform to connect women with medical health or medical resources, mental health resources, pelvic floor physical therapy resources, and also community where we can kind of share these stories, maybe for the first time ever, and understand that, we're not alone in these struggles, and hope does exist, and it's, readily available for you, and where to find it.
And where can people find this?
Yeah, so we're available in both app stores. Rosie is an app that is free to download on both platforms. There are subscription options available depending on if that's what people want, but they're welcome to kind of explore and check things out.
It's ROSY.
You got it.
Okay, I have one viewer question that I want to get to, and you sort of started to talk about this. Is it common to orgasm in only one way?
Okay, so I'm not quite sure what that means, but what I think it means is through clitoral stimulation.
It was like a position.
A position, yeah. So that makes a lot of sense. So women, like I mentioned, have orgasms. 87% of women have orgasms through clitoral stimulation. And the clitoris is much bigger. I should have brought my model because I have some models, Sonia.
She has models.
The clitoris is much bigger than the clitoral head, which is what we see at the very top of the vaginal opening. The clitoris actually extends down into the labia and back into the vagina. And it's just a bunch of nerve endings all in one place, right? And so when the clitoris is stimulated, that's when most women experience orgasms. So it makes sense that if there's a position that stimulates the clitoris more than another position, that's going to result in orgasm where the other ones don't.
That's why we have favorite positions.
There we go. Exactly.
I need a drink of water. I really appreciate this.
No, it's my pleasure.
Health check.
So fun. Yes.
Thank you so much for being here with me today. I feel like we need a whole series on sexual health.
Well, we've got you if you want to do it.
I think we might need to do this.
For sure.
Thank you so much for your time.
It's my pleasure, honestly, and thank you for talking about this. I know it's not easy.
I'm sweating.
But it is so important. So thank you and for bringing this to all of your viewers. I really appreciate it.
Okay. Well, on that note, if you guys liked something, learned something, please comment, share this, subscribe. Take a deep breath. See you next time on The Shift.
This series was brought to you by The Wealth Woman. Why settle for a traditional financial advisor that only keeps you from going broke when you can work with The Wealth Woman? She'll show you how to build wealth for both your lifetime and generations to come. Money is just a tool to help you build a life you're excited about. Visit www.wealthwoman.com to learn more. And don't forget about our friends at Glam House Collective. Let's get glam.